And please press the microphone button. Thank you.
Okay. My name's Ugochukwu Enyinaya Akoma. I am a family physician, originally from Nigeria, but I'm a Guahan right now. I am Chamorro by association, and I own a practice on the island called Hepzibah Family Medicine Clinic. We've been open for about 5 months now, and we do provide medicinal cannabis consultations for our patients. Thank you.
So you are one of the doctors that is actually providing the certification for patients to obtain medicinal cannabis cards from public health, is that correct?
Yes, sir.
Maybe can you tell us a little bit about how that process works on your end?
Okay. So my coming to this hearing today is not necessarily to promote recreational use of cannabis. I have no personal objections to it. But as a family physician, I am an advocate for my patients. And I believe that my job as a provider is to provide healthcare information. Being a doctor means being a teacher, and to have a shared decision-making with my patients. What any patient decides to use is the prerogative of the patient. I can only guide and provide information. So today, I see an 81-year-old who's had chronic back pain and chronic knee pain for more than 30 years. He was scheduled for knee replacements, which he doesn't want to. He's otherwise been healthy. He only has high blood pressure, which is controlled. And he's been on all kind of pills, all kind of opioids, non-steroidal anti-inflammatory medicines, and he just tired of it. He wants something different. And he believes that medicinal cannabis will make a difference for him. Now, for such a patient, sometimes people misconstrue medicinal cannabis for drug of abuse. There are a lot of people who get addicted to opioids, which we legally prescribe. People get addicted to benzodiazepines, which we do prescribe. So with every drug, there's risk of addiction. But there are patients who benefit from medicinal cannabis. And there are proven benefits of cannabis in the healthcare sector. And I was talking to one of my patients last week, and I told him that even for more than 20 years, we have been using a synthetic form of cannabis called Marinol. It's actually a Schedule 3. Even though cannabis as a whole is said to be Schedule 1, Marinol, which is a synthetic cannabinoid, is a Schedule 3. And we've been using them for cancer pain, for nausea, vomiting, for appetite stimulation for more than 20 years. So cannabinoids are not strange, and people be using them locally and medicinally for a long time. So when I see my patients, my job with them is to discuss what need they have that made them think they want to try medicinal cannabis. What have they done? Go over whatever imaging they've done, whatever tests they've done, what medicines they've been, what worked, what didn't work. 80% of my patients so far are veterans who either have PTSD, severe anxiety, been physically broken, in different ways. I seen a young man today, too, who is in his 30s, but he was an avid swimmer for a long time. And he's banged up his body for a very long time. He's had multiple surgeries in his knee, and he's been addicted to opioids before, and he doesn't want to do it anymore. So I've been concerned with all the certifications I give that my patients do not have any safe access. They have no way of legally acquiring cannabis on Guam right now, and that's my concern. My concern is also the only means of consumption on Guam now is by smoking. There are safer ways of consuming cannabis for medicinal purposes that don't involve smoking it. But as long as cannabis is illegal and people are not going into other means of production, we're going to stop by encouraging black market, so to speak. I am not aware of anybody who has actually grown. I know there are about 3 or 5 permits to grow, but nobody has mature plants right now. So all the cannabis patients on the island have had to get their cannabis illegally, so to speak. So my support for this bill is to be able to give safe access to the patients, not until you decriminalize cannabis, it's still going to be sourced illegally. And that takes away from the whole benefit. So that's why I lend my support to your bill. It's called adult use, but I rather it's adult medicinal use. But make it easier for patients who require cannabis to acquire them legally. For a long time, physicians, we've tried to tell our patients how to live their lives, try to tell them the do's and the don'ts. But it's time we start listening to them, start working with them, and really implement shared decision-making, knowing fully well that the option is to the patient. If a patient has chronic headache, chronic insomnia, chronic musculoskeletal pains, and they tell you they've been getting benefits from cannabis, it's not my place to tell them they can't, because I know there are research in other countries that have shown that cannabis is effective for most of the symptoms that they have. So they deserve the option to use cannabis if that's what they want. So to that extent, I support your bill, sir.
Thank you, Dr. Akoma. I have another question. There was some testimony earlier today about how there are certain ailments that are not in the law. So the law only allows for doctors to certify that patients can benefit from cannabis, but there's only a certain limited amount of ailments that are on that list. And I've been told, and there was testimony today, that there are certain ailments that aren't on the list, and that's one reason why patients also are not able to get any doctor to certify certain ailments that simply aren't in the law. Is that something you've encountered?
No, because again, whoever gave that testimony should go back and read the law again. Even the paper in which you signed the certification does tell you that a debilitating condition could be any of the listed or any other condition that, in your opinion as a provider working with your patient, you determine is debilitating for that patient.
I see. Okay.
So there is a caveat that allows you, when, let's say, a patient has chronic headache, it may not be one of them listed, but if they're not able to be productive and they're not able to be functional, that is debilitating for that patient. So it's for you, the provider, working with this particular patient, to define how disabling their symptoms are, and are they getting benefits from cannabis or not. And on the other hand, what we do is not really a recommendation. We do not recommend people to use cannabis. We do not prescribe cannabis. This is a certification that says, given all the information we have from the history, from the exam, from any test that we have, this patient may benefit from medicinal use of cannabis. It's not proven that they will. We have no way to say categorically this patient will. So we're not giving any prescription. There is no dosing, it's patient dosed. So it's not a prescription, it's not a recommendation. A patient can have the cannabis card and still decide not to use it. So it's not like when we prescribe blood pressure medicine for you, we ask you to bring your boron when you come for follow-up, so we'll make sure you're taking your medicines. No, this is just saying, if you have itching on your skin and you have aloe vera leaf in your yard and you can get the juice out of the vera and apply on your skin and it helps you, maybe you should try it. That is more like what it is. It's not our recommendation. It's not a prescription. It is agreeing with the patient who tells you, I am getting benefit from medicinal cannabis for my condition.
Thanks. One more question. You mentioned some patients that are using opioids. They've been prescribed opioids. And I know that there is an opioid epidemic in the United States, and there's actually been a large increasing number of deaths due to overdose from opioid use. And there's some data I've read that shows that cannabis can be used to get people off of opioids and maybe to reduce the instance of opioid addiction and opioid overdose deaths. Do you know anything about that?
Well, what I will say to that is when we got into medicinal cannabis on our Facebook page, it's our non-opioid pain management. Now, why do people get hooked on opioid? Why they overdose? Usually, most of them have a pain. There are the addicts, but there are people who had genuine pain and they develop tolerance to opioids over time and they continue to take more than prescribed. That's where the addiction comes in. So if you provide them an alternative to control their pain, then you can safely move them off of opioid, if their pain is controlled without the opioid. Now, in my short stay with my private practice, I've had a few patients who come in strictly for opioids, and they have very confusing complaints. They have very confusing signs. They come to you, but the more you get to know them, you realize they're putting up an act to get the opioid. Now, I was discussing one of my patients earlier. I said, I finished medical school in '98. I did medical missions in Nigeria for about 7 years before coming to the US. While in the US, I have done my residency in Arkansas, New Jersey, worked in Iowa, worked in California, worked in Texas, worked in Hawaii, and now I am here. I've worked in different settings. I've worked in the ER, inpatient, and outpatient clinics. And so far, I haven't had any patient that came to the ER from cannabis overdose. Maybe there is somewhere. I haven't had somebody who came into the ER from cannabis withdrawal. It doesn't mean people are not using cannabis, but we've seen a lot of people who come in overdose on benzodiazepine, overdose on opioids, and every other medication will prescribe, right? So, yes, I believe that when properly used, cannabis is a safer option to opioid medication for control of chronic pain.
Thank you. Senator, did you have anything to?
Actually, my questions might be very similar to Senator Rigel's questions, but maybe I wanted to expand because one of the other people who came up to testify did say, they did state that under our law, that as you stated, any other medical condition or medical treatment or disease for which the qualified patient's practitioner has determined that the use of medical cannabis may provide relief. So that's the conditions you're talking about, right? And then she, then she also stated some of the other conditions on part of her testimony, such as diabetes. And here on Guam, diabetes is such a big problem. Have you ever certified in your short time here someone who has diabetes, like cannabis?
Okay, so if somebody has diabetes, right, again, that is a chronic medical condition. Now, there are other complications like neuropathies, chronic pain, foot disease, which cannabis might help to relieve. But we do not have where we use cannabis as a medication for the treatment of diabetes as a condition. Now, for individual purposes, could somebody get benefit from their diabetes by using cannabis? I don't have any research on the paper to prove that. But for the other conditions, glaucoma is not common in patients who have diabetes. Peripheral neuropathy, like I mentioned, a lot of chronic ulcers, chronic pain syndromes that come with diabetes may be controlled effectively with medicinal cannabis. Now, I haven't had a diabetic patient who came. Most of the patients I've had so far has been people who have chronic pain, or people who have chronic insomnia, or people who have PTSD, anxiety, especially most of my veterans.
Okay. Because I was just thinking that it may be unfair to say, okay, I have diabetes, so I'm going to go and get certified as a patient. But what you're saying is that maybe certain conditions that is caused from diabetes is what will qualify them as a patient.
I don't have any information that says cannabis improves blood sugar or helps metabolism of glucose in your system. So if a patient has diabetes, comes to me as their reason for wanting to be on cannabis, I certainly would tell this patient, you don't have a qualified, that's not a disabling condition that, in my opinion, cannabis will help you with. But if they're coming with glaucoma, with chronic pain, diabetic ulcers that are painful, or they have amputation, they have phantom pain, those are qualifying disabling conditions for which, in my opinion, cannabis may be able to help them.
Okay. And I also thought about some of the, maybe people who just come in who just assume they have a certain condition. I know with your patient, your doctor-patient confidentiality, maybe you can't answer this, but in the short time that you've been practicing here on Guam, do you notice just a lot of people coming up with conditions so that they can be certified?
Well, we've had a few people who we couldn't certify because, again, it's an interaction, and when you do not have any objective evidence to reflect what they're complaining. I mean, there are some complaints you don't have objective evidence, like somebody has chronic insomnia, or anxiety disorder. There's really no test you can do to show. I mean, you can send for a sleep study, so to speak, but, if they want to stay up, they could stay up, right? So, but I've not really had people who make up symptoms just to get certified. I've had people who inquired about if they can apply for medicinal cannabis, and in the course of the discussion, it was obvious between us that they would not have a qualifying condition, and the cannabis may not be the right approach for them. And we discussed that as part of the visit, because again, we are not a cannabis clinic. We are a primary care clinic that do discuss medicinal cannabis with our patients who believe they can benefit for it. Incidentally, we've also had some other providers on the island who, for either where they practice or their personal beliefs, do not want to get involved in certifying cannabis patients, and their patients have come to us, and like the young man I saw today who's 81-year-old, has a primary care doctor, but he came to us because primary care doctor doesn't want to go into the medicinal cannabis certification
I guess that was
program.
part of my question is like, I mean, are the patients rolling in because, they're looking for a physician or a practitioner that will give them a certification for cannabis?
I've only had 3 patients who had primary care doctors who actually sent them because primary care doctor didn't want to get involved. One of them has terminal cancer, has gone through chemotherapy, has radiation burns and has post-radiation pain that only cannabis controls for him. I even had a discussion with another physician yesterday who said he had a 91-year-old, who fell and broke his tailbone, and only wants to use cannabis. And he personally certified this patient, even though he doesn't do much certifications, because he saw the need for this patient. So those are who we see right now. I've not really seen any, this is my opinion. Anybody who is addicted to cannabis, anybody who is abusing cannabis, don't need a certification. They know how to get it. The people who misuse cannabis do not come to us. Because then the people who come to us are people who are professionals, who have a job, who are seeking protection to be able to safely use cannabis for their condition. The junkies won't come to us because, again, they can get cannabis whenever they want. They don't need us for that.
I truly appreciate your testimony because really part of this whole process is education, and it's helping people to understand what the benefits are and what the pros and cons of cannabis is, whether it be for medicinal use or for even adult use. And I think the more we educate people, the more they'll understand, because there are a lot of people who will stand up here and testify that it has helped them, and then there are a lot of people who just completely they don't even want to hear what the story is just because. And those are the people that we're trying to reach, just to help them understand.
This is what I tell everybody who wants to listen, that every medicine is a poison, and every poison is a medicine. The most potent poisons in the right quantity for the right purpose are very good medicines. And the best medicines in the wrong quantity for the wrong purpose are very potent poisons. So anything you consume in any form has side effects, including water. People have died from water intoxication. We've seen people in the ERs with liver damage from Tylenol. We've seen people who come with gastritis from ibuprofen. I mean, simply drugs that are over the counter people get all the time. So there are side effects with every medicine. So when anybody consumes any medicine, I cannot predict how they're going to respond to it. Somebody can take cannabis and it calms them down, it helps them sleep. Another person can take cannabis and it wiles them up, raises their heart rate, raises their blood pressure. There's no organized response to any medicine. Somebody will take Zyrtec, cetirizine, or Claritin, and they snooze for the whole day. Some other person takes it, it doesn't do anything to them. A common cold medicine called chlorpheniramine will get me all wired up the whole day if I take it. Some other person will take it and go to sleep. So how we respond to medicines vary. So it wouldn't work the same way for everybody. Some people will take cannabis and it wouldn't help them with their pain. Just like if every medicine that's meant for pain does control pain, we won't have so many different types of opioids, so many different types of non-steroidal anti-inflammatory medicines, because somebody can take ibuprofen and that's all they need for their headache, and that person will take Tylenol and that's what they need for their headache. There is no one-size-fits-all when it comes to healthcare. It's individualized.
Yeah, we have such a very strong pharmaceutical industry, and the cost of medicine is so high, and like opioids is addictive, and so I'm a very strong advocate for the fact that marijuana is the lesser of all evils, and you're right, it does affect people in so many different ways, and there are just some people that just will not be persuaded.
The common thing people who are schizophrenic are most likely to abuse drugs. So if a schizophrenic takes marijuana, maybe they can start having auditory and visual hallucinations. Is it from the cannabis? Is it from their medical condition? So being schizophrenic predisposes you to using drugs. Now, when you start having the side effects, is it the drug that is causing the side effect, or is it the original illness? Again, it's individualized. What bothers me the most with the cannabis debate is there is still no safe access. There is no way for qualifying patients, including cancer patients, to legally, safely obtain cannabis on the island right now. And I hope in some fashion that this bill addresses the supply side of the equation.
Thank you. Thank you so much for your free professional consultation.